Well, it looks like for healthy Americans, no restriction is too burdensome as long as it is done in the name of public health. Yet, strangely, our leaders don't seem to care much about those who actually are at severe risk from the coronavirus. In both Pennsylvania and New York, authorities ordered nursing homes to accept infected patients. Thousands died. For some reason, that scandal is not on the front page of the New York Times every day. Why is that? Alex Berenson used to work at the New York Times. He's the author of the book Tell Your Children. For the last 2 months, Berenson has done what journalists are supposed to do. He has buried himself in the facts. He has pressed the powerful to account for their decisions. He is now the host of Fox Nation 101, COVID Contrarian. It's on Fox Nation. We're happy to have Alex Berenson join us tonight. Alex, thanks so much for coming on. Why isn't this... So the premise of all of this is we care so deeply about protecting the population from this virus that we'll do anything. We'll shut down the entire country. Given that, why aren't they apoplectic and apologetic over what happened in nursing homes?
Listen, that's a media question. I'm not as interested in media questions as interested in thinking about what to do going forward. And,
okay.
You know, it does seem like at last New York State and Governor Cuomo are finally taking the right action to try to protect some people in nursing homes. They're doing it 2 months and 5,000 deaths late, but at least, you know, they are now talking about not letting people who have COVID be discharged back into nursing homes. You know, they could do other things. For example, in Florida, which has had many fewer nursing home deaths per capita and overall, the governor of Florida didn't allow COVID patients to be discharged into nursing homes from the beginning. And actually, Florida has been aggressive about trying to test people in nursing homes, trying to make sure that homes don't have infections. You know, another thing you can do with nursing homes is you can prevent people from visiting, but obviously there's a cost to the people inside the homes when you do that. You know, so everything is a balance, but clearly the governors of New York and Massachusetts and Pennsylvania have a lot to answer for, and nobody's really asking.
So it sounds like, at least in New York, by your description, that science is taking a primary position in decisions going forward in nursing homes. Do you see that same impulse at work in other restrictions? Like, are they following the science as they think through how long to keep these lockdowns in place?
Well, no, I mean, that's a much bigger question, and the answer seems to be no. And really, the number one place, or two, the number one and 1A places we're seeing that right now are A, this very, very slow walk of school reopenings and hints that schools are not really even going to be reopened in the fall in any meaningful, full way, which is incredible and just terrible. You know, in a lot of Europe now, elementary schools are already reopened. And then the other big issue is masks and this idea that we're going to trade, we're going to reduce some restrictions on businesses, but in return, everybody in Los Angeles County, for example, has to wear masks when they go outside. This is absurd. It's absurd on a number of levels. First of all, there's very, very little evidence that the coronavirus is transmitted outdoors anyway, whether or not somebody's symptomatic, whether or not there's a mask. And second of all, there's actually a really good paper in a CDC journal in in February it came out, so 4 months ago, which means it really predated the coronavirus crisis, about influenza and masks. And it said basically that masks don't help don't reduce influenza transmission at all. So no, there's no science behind this.
Yeah, but you'll still get yelled at, maybe arrested for not having one. Alex Berenson's documentary, we should say, is streaming right now on Fox Nation and definitely worth looking up. Thanks so much for coming on tonight. I appreciate it.
Thanks, Tucker.